Assalamualaikum and welcome to everyone. We are from Group 1. Today we would like to present to you our FLIPBOOK project on the topic of anatomy of bone. First of all, let me introduce our group members, which consist of Hussain, Youssef, Hashim, Karira, Norfarahanis Bt Kamarudin, Haziqah, Hani, Binti, Razali, and one Siti, Khadijah, Binti, one Mustaffa, Fikri. In this topic, Hussain will talk about the bone structure and I, Khadijah, will explain to you about the bone function. Norfarahanis will speak to you about the bone-related diseases and last but not least, Haziqah will tell you about the instrumentation that can be used to diagnose disease and the conclusion of our presentation. Now, let us welcome the first presenter, Hussain Youssef.
Bone structure, composed of hard living tissue, hard matrix of calcium salts deposited around protein fibers. Minerals make bone rigid. Protein collagen provides strength and elasticity. There are two types of bone, which are long and short, irregular, flat, and sesamoid. Let's start with the long. Consists of shaft diaphysis and two extremities, epiphysis, longer than they are wide. Examples, femur, tibia, and fibula. For the short, irregular, flat, and sesamoid, no shaft or extremities, diverse in shape and size. Example, short carpals, irregular, vertebrae, flat, sternum, ribs and muscle of bones. Sesamoid, patella. Bone cells, osteoblast. Bone-forming cell present in the deeper layers of periosteum, center of ossification of immature bone, at the site of fracture and the end of diaphysis, adjacent to the apophyseal cartilages of long bones. Osteocytes, mature bone cells that monitor and maintain bone tissues, and are nourished by tissue fluid in the canaculi that radiate from central canals. And the last but not the least, osteoclast, resorption of bone to maintain the optimum shape which take place at bone surfaces under the periosteum and round the walls of the medullary canal. A fine balance of osteoblast and osteoclast activity maintains normal bone structure and function. Spongy bone and compact bone make up the long bones of human skeleton. Let's start with spongy, also called cancellous or trabecular bone, surrounded by compact bone, highly vascularized and porous tissue, home to the bone marrow and hematopoietic stem cells that differentiate into red blood cells, white blood cells, and platelets. Trabecular are spaces created in the tissue by thin areas of osteoblast cells. Trabecular bone has about 10 times the surface area of compact bone, make up about 20% of a human skeleton. And now I'll talk about compact bone, also called cortical bone, surrounds spongy bone, makes up 80% of the bone in a human skeleton. Smooth, hard, and heavy compared to spongy bone. Made up of unit called lamellae with sheets of collagen aligned in a parallel pattern that gives the bone strength. Blood vessels supply compact bone with oxygen and nutrients through Haversian canal or osteons.
The bone or skeletal system is one of the body systems composed of bones and cartilages which performs the following critical functions for the human body. First, let us focus on the most apparent function, the gross function, which is visible by observation. Simply, by looking at someone, we will know for sure there's something supporting their body, help them move and protect them. Therefore, we come to the first main function of the bones, which is the bone supports the body. The bones and cartilage of the skeletal system compose the scaffold that supports the rest of the body, such as the steel beams of building provide scaffold to support its weight by ensuring their steadiness and strength from collapsing due to natural disasters. The bone is also for attachment of soft tissues and organs. Without skeletal system, the human body would be just a limp mass of organs, muscles and skin, loosely hang like the tube men in front of the shops, flapping their hands. Even our beautiful and handsome faces without the bones just will be a flat face full of muscles, no shapes. So be grateful of what Allah or God have created us with. Taking for examples, the bones of the leg, pelvic girdle and vertebral column is to support the upper part of human body, and mandible or jawbone is to support the teeth. Second, the bone facilitates movement. Similarly, the bones are also the points of attachment for the muscles, while some only serve as the support for the muscle, and others also transmit forces produced when muscles contract. So, joints, connective tissue, and muscles work together to make the body parts mobile. The bone also acts as leverage by the bones as levers and joints serve as fulcrums that can change the magnitude and direction of the forces. By referring to figure 1, we can see how the bones support the movement. The bones act as levers when muscles span a joint and contract. Need to remember, unless our muscle spans a joint and contracts, the bone do not move. Third, the bone protects the internal organs, basically from injury by covering or surrounding them. For examples, the ribs and sternum protect heart and lungs of the human. The vertebrae or backbone protect the spinal cord, while the skull or cranium shields the brain. Let's look at figure 2, how the bones protect the brain. The cranium completely surrounds and protects the brain from non-traumatic injury. Now, let us move on to the metabolic level. The fourth critical function of the bone. The bone produces blood cells. This process is known as hematopoiesis. The bone contains of two types of bone marrow, the red bone marrow and the yellow bone marrow. The bone marrow is the soft and spongy tissue located in the center of most bones of the human body, such as the hip and thigh bones. In the red bone marrow, there is the hematopoietic stem cells that can form blood cells. These hematopoietic stem cells then can change into three types of blood cells, which are the red blood cells, white blood cells, and platelets. Lastly, the bone functions in storing and releasing minerals and fat. The bone matrix acts as a reservoir for the minerals important to the body. For instance, the calcium is important for muscle contractions and transmission of nerve impulse processes, as well as potassium, vitamin D, and etc. However, these minerals not only to be stored in the bone tissue, but can also be released back into the bloodstream for maintaining the levels needed to support physiological processes in the body. The bone is also the site for fat or lipid storage. In addition, the yellow bone marrow contains of mesenchymal stem cells or the marrow-stromal cells which can produce fat, cartilage and bone, and the adipocyte cells found in the adipose tissue. The triglyceride is one of the form of lipid in blood and is stored in the adipocytes. The fats can then serve as the source of energy. The figure below is the structure inside most of the bone that contain bone marrows. Next, I pass this presentation to Norfarahanis. Thank you.
Thank you, Khadijah. So I will be explaining about the bone disease. One of the common diseases related to bone is osteoporosis. It is a bone disease that causes a loss of bone density which increases the risk of fractures. Its name comes from Latin for porous bones. If we view a bone under a microscope, a healthy bone looks like a honeycomb. When osteoporosis occurs, the holes and spaces in the honeycomb are much larger than in healthy bone. There are many factors for osteoporosis. One of them is age. The older you get, the greater your risk of osteoporosis. When you are in your 30s, your body starts breaking down bone faster than it's able to replace it. This leads to bone that's less dense and more fragile, thus more prone to breakage. Another factor is gender. Usually, osteoporosis occurs in women around the age of 45 to 55 years old. Due to the change in hormone levels associated with it, menopause can cause a woman's body to lose bone even more quickly. Other factors are such as being Caucasian or Asian, having a family history of osteoporosis, poor nutrition, physical inactivity, smoking, low body weight, and also small bone frame. Second bone disease is osteopenia, which is thinning of bone mass. Osteopenia and osteoporosis are two very similar conditions, but one is more severe than the other. Osteopenia usually doesn't cause symptoms unless a bone is broken. However, some patients who present with osteopenia complain of dull back pain. From the picture shown, you can see the difference of holes and spaces between osteopenia and osteoporosis. Since osteopenia and osteoporosis have similar condition, there is a way used by orthopedic to differentiate between both diseases. They use bone mineral density (BMD) test to diagnose both osteopenia and osteoporosis by measuring the calcium levels in bone. This test is non-invasive and painless. They usually perform on heel, shin bone, spine, wrist, finger or hip. Two common types of BMD tests are radiograph and dual energy X-ray absorptiometry DEXA. Last but not least is osteomalacia. It is a disease that weakens bone and can cause them to break more easily due to problems with bone formation or the bone building process. It usually occurs in people who don't get enough dietary vitamin D and have little sun exposure, such as older adults and those who are housebound or hospitalized. Osteomalacia can be caused by vitamin D deficiency, drugs, certain surgeries, celiac disease, and kidney or liver disorders. Patients who have osteomalacia will undergo some of the symptoms, such as felt pain in the bones and joints, muscle pain and weakness, bones that break more easily, particularly in the hips, lower back, and feet. They also have difficulty walking and a change in how they walk, have muscle cramps, and felt pins and needles in the hands and feet because of low calcium level. From the picture shown, you can see the difference between normal bone and osteomalacia. In osteomalacia, the total mass of bone may be normal but it is soft and weak because it is not properly mineralized. In children, osteomalacia is known as rickets. That's all for bone disease, and for the next slide, I will be passing the baton to our next presenter, Raz.
Next, I will talk about the instrumentation that can be used to diagnose bone disease. The first one is X-ray. Bones absorb almost all the radiation because they are so dense, so they appear as white or gray outlines on the X-ray image. X-ray is used to detect or rule out problems like fracture, signs of wear and tear, abnormal positions of bones or bone inflammations. The second one is magnetic resonance imaging or MRI. MRI used for things like knee, shoulder or spine problems. It also shows signs of wear and tear, ligament and meniscus injuries and inflammation in bones. The example of X-ray and MRI scan is shown here. That's it for our presentation about bones. Thank you for your attention.